Hello, everyone. Welcome back. This time we are going to be talking about boundaries, specifically personal and professional boundaries in massage therapy. Through most of our business and ethics lectures for this class, we're going to be using Mosby's Fundamentals of Therapeutic Massage. All right, so what are boundaries? These are anything that separate people from their environment and from other people. This could be a physical boundary, which we'll talk about, an energetic boundary, a verbal boundary. There are many ways to set those. According to fundamentals, professional boundaries are determined by legal, ethical, and organizational frameworks. So we're talking about the law, like your scope of practice, ethical, if what you're doing is right or not right, if it's okay. An organizational framework, what does your company, your employer say that you can and can't do in that work environment to maintain a safe working environment for the client and massage therapy professional? Many ethical dilemmas are related to boundary issues, all right? So we've already talked about ethics. Now we're diving into boundaries and how crossing those boundaries is going to take us down ethical dilemmas. So boundaries can be categorized as permeable, also called porous, rigid or flexible, and permeable or porous boundaries are weak and easily crossed. We don't have our boundaries set in place very well. This leads to a lack of clear self-definition and potential for over-involvement or vulnerability. If you have a hard time saying no to people, or if you're easily influenced by your family or your friends or your religious group or the society around you to change your opinion for you, or if you've got a tendency to prioritize other people's needs over your own. Now, this isn't necessarily just if you have kids, because I feel a lot of us as parents may feel that we are in this boat, but this is, can your boss or your coworkers keep asking you to add on work to the point where you have no life work balance? Do your friends keep asking you to do things or constantly pay for dinners and you're doing that and you're running out of money, but they never cover you, right? Someone with porous boundaries might take on that extra work or responsibility even when they're already overloaded. They don't say no often enough. Rigid boundaries are strict and inflexible. This usually creates a lot of distance between people and hinders a lot of connection and intimacy because there's usually a very firm barrier there. They normally have difficulty trusting other people. They're very emotionally detached. They have a tendency to avoid vulnerability. Now, we could argue the psychological reasons behind that in a completely different topic, but overall, we don't trust for whatever reason that may be, and we avoid being vulnerable. So, someone with rigid boundaries might avoid close relationships or they struggle to ask for help even when they need it. This could even show up in your schoolwork if you're struggling with assignments or meeting your deadlines and not reaching out to your instructor or a mentor or someone else to help get you on track or help you with time management might show that you actually have a rigid boundary and you have such a strong sense of independence that you are tripping yourself up by not asking for that help. Flexible boundaries are the ones that we typically view as being healthier. They are adaptable. They allow for connection, but they also allow you to back away and do a little bit of self-protection. So you've got more self-awareness, self-accountability. You're able to set your limits. You can say, hey, look, I'm willing to work, extra hours this week and I can do it for a little bit, but I know if I do it for a long time, it's going to burn me out. So then I have to put my foot down and say, no, I need to be able to have this time off to reset myself for my own health. And that is you taking care of self-protection. All right. You have the capacity for both intimacy with others as well as independence. You ask for help when you need it, but you know that you can do it on your own if you have to. Someone with flexible boundaries can comfortably share their thoughts and feelings while also maintaining some personal space. Here's a good infographic from Therapist Aid if you want to pause and look at it about rigid, porous, and healthy boundaries. This is lightly covered on the MBLEX. This is about the only place that we're going to talk about it in class. So I would recommend maybe even printing out this slide to keep with you. All right, so we need to be able to identify our personal boundaries to be able to develop our professional boundaries. So, as we grow up into adulthood, we take all of those experiences we've had in life, they shape us into believing what we feel is correct, and that defines our personal boundaries. Okay, we take all of those morals and values that we've learned and built up in our principles, and they help us shape our boundaries. As professionals, not only are we responsible for learning our personal boundaries and our professional comfort zone, we also need to find our client's comfort zone and boundary to maintain that. Anything that prevents us as massage therapists from being able to touch a person in a respectful and non-judgmental way must be considered so that you can decide who you want to work on as a client and do it well. If you have a hindrance, like a personal bias against a type of person or a prejudice, whether that's about body size, about color, about gender, or even attitude, politics, things of that nature, personal beliefs, these things might create a boundary for you to being able to work on people in a respectful way. Some people don't relate well to children. If you don't have children, you're not used to children, you don't like children, don't work on children. That's an ethical reason to send them to someone else. You don't have the experience to do pediatric massage. Fantastic. You might be uncomfortable with someone of a specific gender. I know a lot of female therapists don't want to work on male clients. For an entirely different reason, a lot of male therapists don't want to work on male clients. It depends what your reasoning is. If it's an appropriate boundary that has enough ethical reasons behind it to be valid, whether or not it's considered discrimination. And we'll talk a little bit about that later. But you need to recognize, right now, we just want to recognize if you're going to be uncomfortable with working with a particular type of client. What if they have a disease that you're uncomfortable with? What if they have Parkinson's and they're shaking everywhere? Or what if they have Alzheimer's and they slip in and out of being cognizant of where they are? If you are uncomfortable with those type of clients, then you're potentially going to be uncomfortable with working on them, and that's going to be conveyed through your touch to them. A potential client could have a personal behavior like constantly sniffing. What if they have ADHD and they get excited and they start talking really loudly? Or culturally, what if they're Sicilian or Italian or, from another culture that tends to be very emotive with their words, a lot of gesticulations and stuff with their hands. If you find that very off-putting, it might be difficult for you to be in the room with them, and that behavior is going to interfere with your ability to be the best massage professional for that particular client. So you need to find out your comfort zone before you start bringing in a lot of clientele. All right, so we're going to talk about some types of boundaries, and that could be physical boundaries. These relate to personal space, comfort with actual physical touch, and respecting someone's body. So, how close are you to someone in a conversation? Are you right in their face? Like, hello, like, are you right here? Are you a little bit further away? Are you breathing in their mouth? Are you a little bit further away? Are you obtaining consent before physical contact, like hugging or touching? I had a boss that used to hug me all the time. He hugged all the ladies. It was awful. If you have a client who has some type of touch aversion from assault or something of that nature, you need to ask permission before touching them to make them feel safe and to make sure that they are giving you enthusiastic consent for doing so. You need to set limits on how much time is spent in someone else's space. Some people need a little bit of alone time to recoup. And if you're constantly around people and getting overwhelmed throughout the day, there's no way for their nervous system to reset. There are emotional boundaries. These protect your emotional well being and prevent you from being emotionally manipulated or taking on other people's emotions. So you can refuse to listen to someone's constant negativity. If they're constantly complaining about things and can't come up with solutions, there's a saying, if you're not part of the solution, you're part of the problem. If someone is constantly part of the problem or talking about problems, and you find that very off-putting, then set that distance. Set limits on how much emotional support you provide to others. If you have someone that constantly needs you to support them and do things for them, this is something that's best done by a therapeutic professional and not necessarily you as a family member, friend, and definitely not as a massage therapist. All right, that's out of our scope of practice. We can listen empathetically, but we cannot give any type of talk therapy. We are touch therapy. You need to avoid situations that trigger strong emotional reactions. There's also sexual boundaries, all right? We're going to talk about that more in detail in a different lecture, but these define what you are comfortable with regarding sexual activity and intimacy. This relates more to your partners in your life than it does in the massage therapy office, but you do need to establish clear expectations in the massage office that there will be nothing of an intimate sexual nature occurring. Time boundaries is huge, all right? These involve setting limits on how much time you spend with others or on certain activities, allowing for personal time and prioritizing your own needs. What this looks like in the massage office is making sure you have enough time between clients to go to the bathroom, have a drink of water, have a snack if you need it. Make sure that you can change the sheets and clean things up with an appropriate disinfectant without driving yourself crazy or cheating your client out of their set time boundary. They're paying for a set amount of time for you to work on them. You can't cheat them because you didn't set your own time wisely. There's also intellectual boundaries. This means respecting others' opinions and ideas while maintaining your own beliefs and values. All right. You may have a client that is saying something that you think is absolutely ridiculous. All right. And you can listen to them and their perspective without interrupting them or belittling them. You might absolutely not agree, but it's not your place to argue with them as a massage therapist. Listen. If they are getting extremely off topic or making you uncomfortable, you can redirect them to tell you how it feels to be massaged or what they're feeling in their body at the moment, and redirect them to specifically what's happening in the massage room if you need to, but you never argue with them. You don't get emotionally charged having a discussion with a client, even if they are abhorrently wrong. Okay? Shut it down. They have a right to have different beliefs than your own. Another boundary is material boundaries. These relate to financial matters, possessions, and resource sharing. Set limits on how much you spend on others or allow others to spend on you. In the case of working in a massage office, this might be you not sharing your resources, your sheets, your lotions, your oils with other therapists, things that you have purchased to use on your clients. You don't have to share those with another coworker if you don't have, if you don't want to, you don't have to if they're your possessions. Protect your financial independence. You don't need to share tip information with other massage therapists, but you do also need to set boundaries with your clients and not accept gratuities that are going to be deemed unethical. All right, spiritual boundaries. These protect your right to believe in what you want, worship as you wish, and practice your own spiritual or religious beliefs. All right, you can refuse to participate in activities that go against your beliefs, and you can set boundaries around religious discussions or practices. I actually had to set a boundary with a client whose religion and personal morals and values and principles varied very deeply from mine. And I had to stop the conversation because she was actually upsetting other people in the waiting room with a lot of the things that she was stating. If you are non-offensive to others, you can absolutely do as you wish. If your client becomes offensive to others, this is when you need to redirect them to the space that they are in to focus on massage therapy. There's also digital boundaries. These relate to how we want to be treated in a virtual space, as well as how we want to engage with others online. Set limits on how much time you spend online or on social media, especially on your business account. Do not engage in online arguments or negativity. That will reflect on your image and brand, which we will talk about later. And you need to protect your privacy online. Uh, I have had people actually stalk me on Facebook and send letters to my office once they have found some of my lectures online. So it's kind of interesting the lengths that some people will go to have inappropriate contact with you. So please keep those things in mind as well for your safety. Right, just like in ethics, our morals, our values, our principles, family values play a huge, crucial role in shaping our personal and professional boundaries. They instill principles like respect, honesty, and responsibility. Like, do you see a parent as when you're growing up constantly calling into work and saying, it's okay, I'll just go in the next time? That might work for like an hourly job, but when you are working with clientele that you really depend on coming back by providing them superior service, if you're always canceling on them last minute, are they going to continue to come back as a returning client? Probably not. Watching the behavior of your friends and family growing up really will at least shape your opinions, if not your current behavior. Your privacy limits. Do you have family members that just bust in all the time while you're in the bathroom? Absolutely no privacy. Whereas they were very, very respectful of your space and always knocking on the door before coming in, like even to your room, even if the door is open. This might shape how you feel about privacy with information your client is sharing or their time with draping and undraping or getting dressed in the massage room. Physical contact. Are you from a family that just grabs and hugs a lot, big, deep, wonderful bear hugs? Or are you with people that don't really like to be touched and you have a reserved sense of touch? How is that going to change with you professionally as you go into the office? Are you going to hug your clients because you're used to touching them all the time on the table? Are you just going to grab them and hug them, or are you going to give them that physical space? The same thing goes for intellectual expression, what you feel is okay to talk about, sexual attitude, sensitivity, emotional connection, and expression. Are you extremely emotional with your clients? That may be crossing their boundary. All right, so it's super important that we explore our professional boundaries by looking honestly at our fears, frustrations, prejudices, biases, and personal and moral value systems. Now, we've covered some of this already, but now we're going to dive a little bit deeper. All right, so what is a bias? I've pulled this definition off of Wikipedia. A bias is a disproportionate weight in favor of or against an idea or thing, usually in a way that is inaccurate, closed-minded, prejudicial, or unfair. Biases can be innate or learned. People may develop biases for or against an individual, a group, or a belief. In science and engineering, a bias is actually a systematic error. It will mess up your data, just like a bias will mess up your professional environment. You will create an ethical dilemma. So, what's a prejudice? A prejudice can be conscious or unconscious. It involves stereotypes, prejudgments, and beliefs, which are usually negative, about a group of people. These beliefs can be based on race, which I would argue is actually color, sex, gender, religion, culture, disability, sexualities, you name it. The way somebody eats, what they eat. Are they a vegan or not? All of these things can lead you to behave in a negative way that can bring up a lot of ethical issues regarding your professionalism. All right, so we're going to define some of these a little bit. So, what is ethnicity? This refers to cultural factors, including nationality, regional culture, ancestry, language. Race is primarily associated with physical features of a person. Sometimes, we're looking at nose shapes, we're looking at hair texture, we're looking at the color of skin. Physical characteristics should be a non-issue for the massage therapist unless it's something that's a contraindication for massage, like a rash. Therefore, something like race should be an absolute non-issue in your massage therapy office. All right. Religion relates to groups of people's relationship to that which they regard as holy, sacred, divine, or worthy of some type of reverence. All right. Religion can be explained as a set of beliefs concerning the cause, nature, and purpose of the universe, cosmos, firmament, whatever you are calling it, usually involving devotional and ritual observances and often containing a moral code governing the conduct of human affairs, which means that they may consider something that you think is entirely normal in the massage office to be immoral because of their religion. So please be aware of these things. Someone's culture, someone's religion may absolutely make them adverse to something you may normally do in your massage office. So please keep that in mind and be aware of these differences in your intake. Right, gender identity and sexual orientation. Gender identity and someone's biological sex are not the same thing. Biological sex is determined by chromosomal, hormonal, and anatomical characteristics used to classify an individual as female, male, or intersex. Intersex is an atypical combination of features that usually distinguish male from female, but those lines can become blurred. Gender identity is an individual's innermost concept of themselves as either male, female, a blend of both, or neither. So, how individuals perceive themselves and what they call themselves. It can mirror an individual's biological sex, or it can be something entirely different. Gender identity and sexual orientation are different as well. Sexual orientation is someone's emotional, romantic, or sexual attraction to other people. People who uh, state their sexual orientation in the massage office, I'm not sure why it would even happen. It's unnecessary. That's crossing a personal boundary into a sexually oriented discussion. The responsibility of the massage therapist is to be respectful. At no point should their sexual orientation matter whatsoever in the therapeutic relationship. It doesn't factor in. Biological sex may factor in due to the type of massage that they are requesting and the areas that you massage them. Gender identity will affect you in the massage office because you need to respect their pronouns for whatever they would like to be called. So, I wanted to pull this quote out of your fundamentals book because I don't know if I necessarily agree with it. And that's the great thing about taking an ethics course because not all of us are going to agree about the same things. Your book says a person's sense of self is important and needs to be honored, which I agree with. In the massage therapy setting, the massage therapist should not emphasize gender identity. A more gender neutral appearance and behavior is appropriate. I don't know if I agree with that. If I went to a massage therapist and she was wearing a perfectly straight, ugly uniform in just a solid brown with no makeup on whatsoever, I wouldn't feel any different if she were wearing all pink in a form-fitting uniform with bright pink lipstick and eyeshadow on. I don't necessarily agree that you as a massage therapist need to create a gender neutral appearance in the office. This might be an opinion of a medical clinic because you want to tone things down. You definitely don't want to wear things like perfumes and stuff due to allergies, but that's a different topic. I don't know that you need to be gender neutral in appearance, so this is something for you to think about. All right, so another thing that can cause issues with a bias or prejudice is social stratification. So this comes with social standing and social class. Are clients really wealthy? Are they perceived celebrities? Are they, a cashier that can barely afford a massage? Who do you treat better in the massage room? Nobody. You treat them equally as a massage client. Their social standing or their social influence outside of the office should mean absolutely nothing on your table. You also need to monitor your own sense of status if you are, say, in a very upscale spa and you get some of the celebrity clientele. You need to make sure that you're not basing your status on who you have as clients either. There is a lot of people, who have toured with the Olympics, worked with sports teams, worked with celebrities, things of that nature. They are no different than anybody else, okay? They're all going to react to an abdominal massage for constipation nearly the same way, okay? Ageism is another issue. The concept of age identity refers to the inner experience of a person's age and the aging process. Like I know my mom says, she feels 50 a lot of days, even though she's 76, and other days she feels like she's 90. Age identity is how you're feeling at the time, not your true age. But your true age can cause a lot of stereotyping and discrimination, usually in the work environment. So be careful of this with your coworkers. If you see an older massage therapist, you might think, man, dang, like, how can they do it? Are their joints hurting? Are they strong enough to do massage? Instead of thinking maybe, wow, they've been doing this for over 40 years. I bet they don't even have to think about what they're doing anymore. So we need to reflect on what our internal stereotyping and bias is against things like age or color, social stratification, religion, and things of that nature. So, how do we make sure that we are addressing and discussing these boundaries with our clients? We need to use assertive communication. This is a direct and respectful way of talking to them and clear listening and expression. All right. You are going to relate to them. You are going to be passive and listen actively. Then you're going to clarify and suggest your boundaries with an assertive stance. You're not going to be aggressive, but you will be firm. You're going to be clear and straightforward. You're going to explicitly state your thoughts and feelings. Your policy is no sexual intimacy in the office. Your policy is, no yelling and swearing in the office. Whatever those things are, you need to state them clearly. And you need to be consistent. If you have a policy about charging a client for a no-show, or if you have a policy set, hey, look, if you are 15 minutes late in a 60-minute massage, you only get 45 minutes. You need to mean that every time because if you start slipping on that, they're going to be angry with you for when you set your foot down on your policy again. They're going to say, well, last time you didn't make me do it. You need to be consistent. And that way, you're not letting them cross your boundaries consistently. You also need to be courteous. You need to respect your client and not communicate in a manner that, passes judgment on them. And you don't presume ill intent. If they're telling you something they don't like, it honestly has nothing to do with you. They've just met you and they're telling you what they don't like from an earlier experience. This is their experience they're speaking about. So make sure you are coming out of your own ego, your own personality, and making sure that you're understanding that this is where your client is coming from and stating their needs and boundaries to you. We're going to talk about nonverbal communication a little bit later on, but make sure that when you're doing this assertive communication about boundaries, that you are, not pointing your finger at them like, why are you saying this? No, stay relaxed, set your shoulders back. You can be tall, don't slump over like, oh, I really wish you wouldn't do that. Like, be confident, but don't be aggressive. And keep your emotions in line. It's very difficult to speak assertively when you are emotionally reactive. You're going to be all over the place, and your listener, your client, is going to be watching your erratic body mechanics and your nonverbal communication rather than focusing on what you are telling them. All right. But once we are aware of our boundaries and we've communicated them, we need to make sure that our clients can establish their boundaries. You need to be respectful in your approach and explain therapeutic boundaries to them if necessary. What is acceptable, again, for us might be offensive for someone else. And you also need to check yourself, because what's offensive to you, especially because of cultural or religious beliefs, um, isn't offensive to them at all. They have no idea that they're offending you whatsoever. All right. You can offend someone unintentionally because of differences in personal and moral value systems, and so can they. So, realizing that that might be accidental is the first way that you can mature professionally and make sure that you can address it in a calm manner and set those boundaries with your client. An incredibly important thing to note is that it is important for the massage therapist to help the client define their personal boundaries. Sometimes people who have been emotionally, physically, or sexually abused have not had the chance to define or recognize physical and personal boundaries. This goes back to when we were talking about the family. If they just bust in while you're in the bathroom, they don't knock on the bedroom door, they don't give you any sense of privacy, they may not even know that they need to have that. I know that when I was in massage school, my very first clinic client was a nurse in her 70s who was overweight in a room full of people, because this was a large student clinic room and we just had little curtain dividers between the beds, but not like at the end of the bed. So there was like zero sense of privacy in this room. And she was supposed to put on a big robe that we had for her that she was to lay down on the table on. I'd cover her in the sheet, then she would take off the robe. She took everything off in the changing area, put the robe over her arm because she was hot and didn't feel like putting it on, and strode naked to the table to lay down on. I was shocked. I wasn't offended, but there were people in the massage clinic who were slightly offended. She didn't think she had offended anybody. She was just happy to lay down and get a massage. She had absolutely no thoughts whatsoever of anything sexual. But because in our culture, a lot of people associate the nude human body with sexuality rather than just being the body that you're living in, it offended a lot of people, and it is considered inappropriate. In some states, it's legal. Some states, it's illegal to walk around naked. So, depending on the state that you're in, it could also be a lawful issue. So, just be aware she had absolutely no intent whatsoever to be offensive, but a lot of people did find it offensive just because of the nature of what she did. This should be self explanatory, but what's the best way of determining a client's boundaries? Ask questions. Is there any part of your body that you don't want massaged? Maybe they don't want their legs massaged. Maybe they're painful with fibromyalgia. Maybe they, don't want their back of their neck grabbed, due to an assault issue. Do you prefer any particular type of music? Some people hate piano, the high-pitched tinkly noises. Some people don't like waterfalls. It makes them want to pee all the time. Some people would, prefer to listen to hard rock or alternative or reggae while they're being massaged. Ask them. It's their massage. It's their preference. If you're a smoker, you need to let them know. You need to ask them if that will bother them, because if you're not appropriately getting it out of your skin, and of course, I always tell my smokers to wear gloves when you're smoking because it does saturate into your fingers. Ask them. If they tell you that it bothers them, what are you going to do about it? Like, this is your chance to think about it now before you have that client. Or, maybe that's something you should tell clients before they actually book with you. You can state, hey, I have 5 or 6 massage lubricants. I've got oil, I've got water-based, I've got creams. What do you prefer? Once those clients' boundaries have been defined, you have to respect them. You have to respect them. If you cannot respect them, you need to refer the client to a massage therapist that can deal with their needs appropriately. I had a client who only wanted to be massaged with arnica cream, and I'll make arnica cream, and because I hand make a lot of lotions, and I will make whipped shea butter with arnica flowers for her, but I can't touch it. I have to make it with gloves. I have to completely be removed from it because it gives me really extreme palpitations. It leads me into cardiac arrhythmia when I get a lot of arnica, and transdermally it will get into your body if you're massaging a client with it. This client only wanted to be massaged with my arnica shea butter. And after I realized I was allergic to it, I had to refer her to another massage therapist. I kept making the shea butter, but she had to get someone else to massage her because she didn't want to be massaged in gloves, which is totally understandable. And I couldn't massage her with the arnica. So you need to figure out if this client and you can still work together, whatever this boundary is. If you're a smoker and they hate that smell, they're allergic to it, refer them out. So again, with that assertive communication, you need to make your client understand your personal and professional boundaries, okay? If you don't want to hear intimate details, because some people get verbal diarrhea on the table, and you don't want to hear about their sexual life, their family life, things of that nature, you need to tell them, hey, we need to keep this conversation about the therapeutic benefits of this massage and what you're looking for in terms of benefit to your body. Keep redirecting them as you continue to work on someone. If they've become your client for a long time, the boundaries can become blurred as that interaction progresses over time. You get to know each other a lot better, and it starts to feel more and more intimate. All right. Blurred boundaries, they can create an environment conducive to the development of some serious ethical dilemmas. So please be aware of that. So we've talked about you referring them out, but the clients can also refuse. You're a smoker, they can say, hey, no, you smell disgusting. I'm not going to get massaged by you. This is the right of refusal. They also have the right to refuse or stop treatment at any time. Maybe you're 5 minutes into it and they've decided something about your touch doesn't feel right to them. They can stop the massage for any reason at any time, and you must comply even though prior consent was obtained, okay? You must stop touching someone when they say no. Keep in mind, you also have that right of refusal, okay? You can refuse to massage them or treat anyone if you have a just and reasonable cause. You cannot do it for a reason of discrimination. If it's kind of ambiguous, that could cause a legal concern. You are bound by a non-discrimination code of conduct, okay? You can refuse to work with anyone, but you have to explain the reasons, okay? Specifically, those reasons should affect the quality of care for that client. And as you state those reasons, this is called disclosure. So, continuing on right of refusal, you have the right to refuse to treat any area of a client's body that you want or terminate the professional relationship if you feel that the client is sexualizing it in any way. If someone's really enjoying you doing leg and glute work, you're not touching the genitals, but they still may be sexualizing it. You can terminate that massage therapy session. You can terminate that client relationship. It just becomes really weird when it's not clearly defined why you're refusing them. If it's not an illness issue or an issue of them being inappropriate, you need to make sure that you are doing it for non-discrimination issues. If you are going down the route that might be considered discrimination in some way, you should talk to legal counsel to make sure the extent of your professional liability for refusing this client. Right. So the biggest issue we see with massage therapists getting into trouble regarding boundaries is usually they start to confuse their personal life with their professional life. Maybe you start talking about your personal life too much with your clients. Um, it's you start those gray areas, especially if you start, working with someone over long periods of time and getting to know them. You have to keep resetting those professional boundaries. You could also set boundaries for yourself that are burdensome to others. Your book has this an example of, you're setting a work-related time boundary for massage scheduling. Maybe you can only schedule from 10 in the morning to 2:30 on Mondays and Tuesdays. Maybe that's when your kid goes to school and that's when you're free. Well, 10 to 2:30 on Mondays and Tuesdays are typically pretty slow most places, and the employer and reception staff might have difficulty filling the schedule since these are slow business days and slow times of the day, right? So this might be burdensome from the employer. I would argue that you do not need to change your boundary, but you may need to find a better fit for employment because you are making it burdensome. I mean, if they're allowing you to do it, fantastic. Stay where you're at if you're happy, but just be aware that your boundaries may create issues for others around you. Just be cognizant of that and realize what could be occurring. That doesn't necessarily mean that you need to change your boundary, just you may need to change your environment. Saying no to people and setting your boundaries is going to take some practice. Maintaining boundaries, especially if you're someone with permeable boundaries and you are a people pleaser, it can feel uncomfortable to say no to people. If you say yes to 3 people, for a massage when you really only have time to do a proper cleaning of your room with 2 people and a quick lunch, and you say yes to 3, you're going to be hurried. You're not going to give them the best service. You're not going to have the cleanest room, which is not giving them the best service. You're not going to have eaten. You're going to be distracted during the massage. So not only are you doing a disservice to yourself, you're doing a disservice to all 3 of those clients as well. So keep those in mind. Saying no isn't always a bad thing. Sometimes it's actually giving them a better outcome as well as you. Okay, what happens when we cross a boundary? A boundary crossing is a transgression that may or may not be experienced as harmful. Maybe we've told a joke that's inappropriate. If we violate a boundary, that's considered a harmful transgression. It could be a very, very minute line between what is considered crossing and a violation. And what is a crossing to one person could be a major violation to someone else. All right. They experience these things subjectively. So you're not going to be able to determine what is a crossing versus a violation for someone else. Some examples of those would be using the wrong pronouns for your clients, inappropriately touching them. Hopefully, this happens by accident. Careless or uninvited words. If you have a tendency to swear, this might slip up in the office sometimes. Sexual misconduct, client reluctance to personal disclosure is an interesting one because you need to protect yourself with full disclosure and intake to make sure that you're not doing anything that could get you in legal trouble or potentially harm your client in the massage room. Inappropriate self-disclosure by either of you. Again, that verbal diarrhea will get you caught up sometimes when the client's asking you questions or they want your advice that you're not supposed to give. Being late to a massage, that's a time boundary issue as well as a couple of others. You need to be respectful of other people's time and they should be respectful of yours. All right, speaking of time boundaries, I know you guys are ready to wrap this thing up. So, what could go wrong with a practitioner? You might lack understanding of boundaries in general. All right, hopefully, this gives you the basics of it. I suggest exploring it a little bit more. You might be unaware of your own boundaries. This is the perfect time to do some self reflection and figure out how you feel about your personal or professional boundaries and get those set in place before you get started touching people. Not understanding or paying attention to client boundaries. Do your best. Not everyone communicates well, but you do need to ask those boundary questions before touching them. Don't make inaccurate or incorrect assumptions about a client's ability to communicate boundary crossings. They may have grown up where it was not okay to speak for yourself. Not all clients have a strong sense of autonomy. They do not speak up for themselves as a medical advocate. You need to ask, okay? You do not choose to ignore therapeutic boundaries as well. You need to make sure that you are maintaining all personal and professional boundaries that both you and the client have set for the session. Right. If you have a client that doesn't advocate or speak about those boundary crossings very well, what are some things that could indicate that this has happened? The client could pull away when certain body areas are touched. They change their communication style, like they start getting really, really talkative or they get really quiet. They could avoid eye contact. Their breathing changes. It could like stop if they're in pain or become shallow if they're scared or could increase a lot if they're getting sexually excited. All right. A client or a client's significant other could make a comment to the staff where you work if they feel something was done because they may not communicate to you, but they may like complaining to others. The client doesn't reschedule with you. What did you do that they didn't tell you about? Okay. Client could bring another person to stay in the treatment room because they may not trust that you're not going to violate a boundary the next time they're in a room with you. All right. Or the client serves you with a complaint. Well, that's a clear communication at that point. But what have you missed before that to lead up to that complaint? So make sure you watch out for these nonverbal cues as well as paying attention to any stated boundaries in the intake. Right. I'm going to leave you with this. The best thing to do is have a proactive discussion. This is a conversation where boundaries are set in the initial phase or working with your clients with the objective of preventing boundary crossings and violations from ever occurring in the massage office. You need to teach them boundary identification and establishing those boundaries with you. Increase your empathy as a practitioner. You need to identify their behavioral cues like breathing changes, verbal changes, posture changes. Ask them questions and encourage clients to speak up. Encourage them not to be nervous and to communicate with you that you are a safe space and they can share their boundaries with you openly because you don't ever want to cross them because you respect them as a client and you respect their autonomy as your massage client. All right, I'll see you on the next one.